The Ministry of Gender, Culture and Children's Services has raised concerns over the rising cases of femicide and gender-based violence in Kenya. Several cases have been received in the last 2 months alone against women, and the alarming and sustained pattern has significantly intensified public concern. Gender, Culture and Children's Services PS Henawendot Cheptumo CS says a 90-day rapid result initiative to eliminate femicide and all forms of gender-based violence has been launched. Rose Wangoi has more details.
Jane, not her real name, is nursing burn injuries after her husband poured boiling tea on her. She's currently receiving treatment at the Gender Violence Recovery Center, GVRC, of the Nairobi Women's Hospital. Another survivor, Mary, not her real name, is waiting to undergo surgery. Mary was heading home when she took a boda ride, and halfway the trip, the rider attempted to rape her. When she resisted, the rider allegedly beat her up and threw her over a cliff.
So she's progressing well. She's undergone 2 surgeries, but I understand the second surgery had multiple procedures, about 4 of them. She's also due for about 3 more. So her situation, she's in pain, of course, but the pain is being managed.
We are going to support her, and we shall be proceeding to our home to go and find out what is the welfare of those particular children and see how we can help.
These are 2 of the many stories the Recovery Center deals with on a daily basis. Gender Cabinet Secretary Hannah Cheptumo on Saturday visited the survivors at the GVRC Center and raised concerns over the rising cases of femicide and gender-based violence in Kenya. The center handles at least 300 SGBV cases on a monthly basis.
April 2025 to March 2026, we supported 3,263 survivors of gender-based violence. 90% of our cases are the female cases, and we have 40% being children.
We equally call upon all Kenyans to reject the culture of silence that allows violence to persist. Protecting women and children is a shared national responsibility that requires action from families, communities, institutions, and the society as a whole.
In response to the growing crisis, the Ministry of Gender, Culture and Children's Services has taken decisive action aimed at addressing the root causes of GBV and femicide.
We're having what is called an RRI, that is a Rapid Response Initiative. And we have said within 90 days, all the cases which have been reported, those which are already, there are those which are in court, there are those which have not, there are those who have not been arrested. We are making a follow-up because that is our mandate.
While the road ahead remains challenging, the ministry's initiative underscores a critical shift towards more proactive measures in addressing femicide and GBV in Kenya. Rose Wangoi, NTV.